This is just a quick lecture on acute kidney injury and chronic renal failure, just to break up the lecture. About what the kidneys do. Okay, we talked about that a lot when we did the introduction chapter and we talked about kidney function and structure. So if you know what the kidneys do, then think about what happens when the kidneys fail, okay, or when they're not working the way they're supposed to. Less waste is removed from the body and more waste stays in the blood. Those waste products can be toxic to your central nervous system, your red blood cells, your platelets. Think about the nitrogen compounds that build up in the blood from protein. That increases your blood nitrogen level, which we refer to as the blood urea nitrogen, and your creatinine, which are two very important components in how we measure renal function. Also, think about the imbalance that you will see of fluid, not only fluid, but electrolytes as well. You can expect if kidneys fail, then fluid volume is going to build up, so people will swell up and become edematous. Hyperkalemia is very, very common, an increase in potassium. Salt wasting and high blood pressure is super common as well. With acute kidney injury or chronic renal failure is not supposed to take in a lot of potassium, and you really have to control their blood pressure very closely. pH imbalance is common, and then think about the metabolic functions that the kidneys control. There's a decrease in erythropoietin release, which means you're going to have a decrease in red blood cell production, and there's also going to be a decrease activation of vitamin D because it's in the kidney where the vitamin D is stored. Okay, so let's start with acute kidney injury. Now this has always been referred to as acute renal failure, but now they've changed the terminology and they refer to it as acute kidney injury. So if you happen to hear me slip and say acute renal failure, I don't mean to, but that's how I was raised, that's how I was taught, so that's how I practice still, but I'm trying to change to acute kidney injury. This is caused by some acute insult to the kidney that rapidly decreases kidney function. So what you're going to see is an immediate decrease in urine output, an increase in serum blood urea nitrogen and creatinine levels, and a buildup of the nitrogenous or nitrogen waste products in the bloodstream. Acute kidney injury, pre-renal, intrinsic, and post-renal. Think about what your medical terminology and what it means, what those prefixes mean, and it will make a little bit more sense as we talk about individually. Pre-renal is the most common form of acute kidney injury. It's caused by a decrease in blood flow to the kidney. So the way I think about pre-renal, I think about the problem is pre the kidney, before the kidney. So it's not necessarily the kidney itself, it's the fact that I'm not getting enough blood flow or volume to the kidney. So there's something going on there. There's some other problem before the kidney that's actually causing the issue. Think about it. The kidneys are supposed to get about 20 to 25% of the cardiac output from the heart. If I have heart failure, then, obviously I'm not going to have a normal cardiac output. That will decrease the amount of blood flow that's going to go to my kidneys. So that could eventually lead to pre-renal acute kidney problems. Now, the kidneys can tolerate a large reduction in blood flow before there's any damage. So somebody with heart failure can go for a long time without actually suffering problems with their kidneys. So think about what happens when you have a decrease in blood flow to the kidney. The glomerular filtration rate drops, or the GFR. Remember what that is, glomerular filtration rate. Normal filtration rate should be about 90 to 120 milliliters a minute. So that filtration rate drops. The kidneys are going to start using oxygen from the blood that they do get simply to keep renal cells alive, not necessarily to perform any type of excretion. And eventually, if the blood flow continues, then oxygen is going to decrease as well. And you know, anytime there's a decrease in blood flow and a decrease in oxygen, ischemia will occur, and you could eventually have necrosis. Some causes of prerenal failure. Think about it before you get to the heart. The heart. I love the heart. The problem is before the kidney. So hypovolemia or dehydration, you're not drinking enough, or for some reason you're not taking enough fluid or intake in. Shock, heart failure, like we just talked about. There also are many, many drugs and diagnostic agents that can cause a problem and decrease the amount of blood flow and volume going to the kidney. One of the biggest ones, and that's so common, are your NSAIDs, your non-steroidal anti-inflammatory drugs like Advil, Aleve. Taking those things in high doses every single day can be bad for your kidneys. Also, ACE inhibitors, that's a type of blood pressure medication. X-ray dye, for certain people, just terrible for their kidneys. So all of those are causes of prerenal kidney injury. First sign you would see and would notice would be a decrease in urine output, or what is that word? Oliguria, and an increase in BUN and creatinine levels. Your second class of acute kidney injury is intrinsic. Remember, intrinsic, intra means intrarenal, meaning that the kidney is the problem here. So there's some type of structural damage within the kidney. Maybe it's the glomerulus, maybe it's the tubules, maybe it's the tissue itself. The most common cause of intrinsic kidney injury is acute tubular necrosis. Now, knowing the terminology that we've talked about every week since we started this class, you know that necrosis is cell death caused by a decrease in blood flow or ischemia, and that's exactly what this is. It's injury that happens to the tubules because of a decrease in blood flow or ischemia, or because of toxins from different drugs or from different infections. There are lots of prescription drugs out there that are damaging to kidneys, and people don't realize that, or really you don't know which person is going to be affected by the side effect. So, acute tubular necrosis may occur from prolonged kidney ischemia or decrease in blood flow. You may see that with someone who is hypovolemic or sepsis. Again, the ischemia would have to be very prolonged, but definitely could happen. Exposure to some kidney toxic drugs, heavy metals, or radio contrast dye. Some people really have an adverse effect from X-ray dye, so that can be a big problem. And then sometimes there are some obstruction in the tubules from different products in the body, myoglobin and hemoglobin being one actually, that would accumulate and obstruct the tubules and cause necrosis. Also, somebody who has acute pyelo or glomerulonephritis actually can suffer necrosis just from the severe inflammation and decrease in blood flow or the effect on the tissue itself. The course of acute tubular necrosis, the initial phase or the onset phase, is where you have the initiating event and the injury. Second course would be oliguria, where you see a decrease in urine output and a buildup of waste products in the blood. Usually, hopefully, we're hoping that they're going to move into a diuresis stage where they actually increase their urine output, but they may not be actually excreting the waste that they need to be. So there actually may still be some waste products in the blood that should be being removed. Although they are making urine now, there just needs to be a little bit more byproducts being excreted by the kidney. And then hopefully we're going to get into the recovery phase where the kidney starts to repair. You slowly see an increase in urine output, and you slowly see your BUN and creatinine levels go back to normal. And that's really what's going to show you how well the kidneys are functioning in terms of getting rid of toxins and waste products in the body. And remember, let's put it all together. Pre-renal, the problem is before the kidney. Intrinsic or intrarenal means the problem is the kidney. And then post-renal is post or beyond the kidney or after the kidney. So normally your post-renal acute kidney injury is caused from obstruction of urine flow beyond the kidney or below the kidney. Either there's an obstruction in the ureter, the bladder, or the urethra. And the treatment would be removing the obstruction, and most of the time the obstruction is a kidney stone. So we've talked about acute kidney injury. Let's move on into chronic renal failure. Chronic renal failure is the end result of conditions that reduce kidney function. Your most common causes are diabetes, hypertension, glomerulonephritis, and polycystic kidney disease. Your two biggest ones of those would be diabetes and hypertension. With chronic renal failure, you see a dramatic decrease in glomerular filtration rate, GFR. Nephrons begin to be destroyed, so the ones that you have left, the nephrons that are left, have to perfuse more and actually will get bigger or hypertrophy. That doesn't mean they work better, they just get bigger. Renal failure all relate to what the glomerular filtration rate is, and you do need to know this. In stage 1, there is kidney damage, but the GFR is normal. It's greater than 90 milliliters per minute. In stage 2, you see a mild reduction in GFR, somewhere between 60 to 89 milliliters per minute. Stage 3, you start to see a little bit more reduction. There's a moderate lowering of the GFR. Your rate becomes somewhere between 30 to 59 mils per minute. And then stage 4, you see severe reduction in GFR, rate being anywhere from 15 to 29 mils per minute. And stage 5 would be straight kidney failure, where your glomerular filtration rate is less than 15 mils per minute. And these people are probably going to move on into what we refer to as end-stage renal disease, where only about 5 to 10% of their nephrons are working at all. Clinical manifestations of chronic renal failure. Think about it. Think about what the kidneys do. There's a great picture in your book. I think it's figure 2211 that shows you the different system effects of renal failure. You're going to accumulate nitrogen waste. You can expect acid, base, and fluid and electrolyte imbalances, specifically hyperkalemia. There will probably be some mineral and bone disorders, particularly hypercalcemia. There are going to be bleeding disorders, a decrease in red blood cells, specifically a decrease in platelets usually, cardiovascular disorders, specifically high blood pressure, GI disorders. Confusion is very common because of the waste products. The nitrogenous waste that are building up affects the brain. Altered immune function, disorders of skin integrity, sexual dysfunction, and altered drug elimination. Again, please look at that figure, figure 2211. It's great because it shows the man and how every system can be affected by chronic renal failure. Treatment, diet is very important that they have low protein, low potassium, low sodium, and moderate fluid intake. depending on what their kidney function is and whether or not they're on dialysis. Dialysis, two different types, hemodialysis and peritoneal dialysis. Once you start dialysis, a lot of times this becomes a lifelong thing, especially for somebody in end-stage renal disease. Basically what they're doing is removing the toxins from the blood and putting the blood back in. So the people will go in for hemodialysis, at least they have to go in 3 times a week. It usually takes about 3 or 4 hours each session, and they will basically take all their blood out, filter it, and put it all back in. So those people can usually drink, in moderation, because even though their kidneys are not working, if they keep up, their every other day dialysis, then they're removing excess fluid as they filter their blood. So a life-changing event for sure. And obviously there are times when people will need a kidney transplant or receive a kidney transplant if they are a candidate.